Spotting fentanyl to save lives. Tonight, a new call on Nevada hospitals to test for it. This as overdoses from the synthetic drug continue to rise. Fox 5's Drew Andre is live tonight with why advocates say this small change would make a big difference. Drew.
Well, Joe, UMC already tests for fentanyl as part of their standard drug screening, but that's not a requirement right now in Nevada. And advocates say if the drug is not identified quick enough, it could be just too late.
This epidemic is changing daily, weekly. The numbers are staggering.
In Clark County alone, fentanyl claimed the lives of 191 people in 2020, 225 last year, and more than 100 in just the first half of this year.
A lot of times when the kids or adults are getting drugs, they have no clue that there's fentanyl that they're taking. So if they simply go to the hospital gives them Narcan, shoos them out the door, they wouldn't have known that they, God forbid, could have died.
Debbie Nadler lost her son to an overdose and started the group Moms Against Drugs with Julie Shamish from California. Her son, Tyler, pictured on her shirt, died of a fentanyl overdose. He had previously been to the hospital but never tested for fentanyl because it's not one of the so-called Federal 5 drugs that are on standard toxicology screenings. This year, California lawmakers passed Tyler's Law, which now requires fentanyl testing in the standard drug panel. This month, the Nevada committee that reviews the death of children sent an email to all hospitals in the state recommending they add fentanyl to the standard testing panel because of the increase of overdoses. The committee says delayed testing causes a delay in the right treatment or services available. Right now, a request to test for fentanyl has to be sent off and can take a few days to have results returned.
If you have a heavy dose of fentanyl and you don't OD, the hospital administering the Narcan needs to keep a watch on them longer because the effects are still in their system.
Nadler says this is just one example of a simple change state leaders could put into law that would help combat the overdose epidemic. And this is just a recommendation by that state committee, so it's not clear at this point if or when something like that could go in front of state lawmakers. Joe?